Kelly Seitz has been a registered nurse for 22 years, has worked with Samaritan's Purse since 2010. As a disaster assistance response nurse, Kelly has served all over the world, including 18 deployments in Libya, Ecuador, Iraq, Haiti, and the Republic of Congo. Dr. Paul, I know you and Kelly have some history together and have worked together quite a bit.
We do, and it's a good history.
Good.
Yeah, Kelly, welcome. We're glad you're here.
Thank you.
Yeah, I think the first time we met was in Haiti, wasn't it? Right after the.
I don't
You
remember
were
from
there.
past cross.
You
We were there at the
we-
same time.
We may not have overlapped, but you were in Haiti, and then most recently we've been in Mosul together, in Bartella, right outside of Mosul, where we served. What was that for the Mosul offensive there? And what a great time that was, but it was a sad time too. So,
Yeah.
but anyway, tell us a bit about when you were in Liberia with the first Ebola outbreak in 2014. What was that like?
Yeah, that was, I've done 4 Ebola deployments total, but that was my first one.
Yeah.
And it was the largest one to date in world history. And so it was a really scary time.
Yeah.
I was there for a month. I went twice. So the first time I was there for a month, and in that first month, every single patient that we had died except for 2. So that's how serious of a disease it is. It was a very challenging time.
Did your husband and your kids want you to go?
That one was a hard one for them.
Yeah.
They always understand the bigger picture and the call on my life,
Yeah.
and they're supportive of that, but that one was hard for them.
Yeah.
But they still gave me their blessing.
Yeah. And you went for a month the first
I
time?
went for a month the first time, and then I went a month later after Dr. Brantley got evacuated out.
Yeah.
I went back with Samaritan's Purse when we re-engaged in Liberia.
Yeah. What was a typical day like for you there?
Well, it was a very long day. It's very hot in Liberia, so that alone saps your energy. We started very early. We had a lot to do. In those days, we didn't have water and sanitation help and other help, so us as the doctor and nurse had to do all of the work.
Yeah.
So we had to care for the patients, triage the patients, go to the ER to triage the patients, admit the patients, discharge the patients, take care of the dead bodies, everything. So it was very long, exhausting work, but more so it was a very emotional time because of so much death and so much suffering. A lot of children, but a lot of time we would sing hymns over them as we would squeeze the bags of fluid into them, and so it was a really meaningful time for me.
So all but 2 patients died, you said?
In that first month that I
So
was
would
there.
that be 100 patients died or 30 patients
Oh,
died?
I don't even remember. It seems so long ago. I don't even remember. It just felt like constant.
Whenever you're faced with situations like that, I get great comfort from the Lord's word where he said in Matthew 25, when I was sick, you cared for me.
Yeah.
And there's something that's sacred and holy about just the caring for the patients, even if they don't make it. And
I learned that.
Yeah. Do you remember a story? I remember one story about a young child that you told. Can you tell us a story, maybe about one person?
Yeah, you're right. It is a holy work. Medical work is a holy work because you're given the privilege to come alongside a patient right up close with them. But in Liberia, I always tell this story, but it's the most meaningful in my memory. But day after day after day, seeing patients die, and we had a young mom. She was in her late 20s. Her sister had died of Ebola and a lot of her family, and now she finds herself with Ebola. And every day, she came in kind of early, so we caught her early, but for 10 days I cared for her every single day, and I watched her deteriorate day by day by day. By the end, on this last day that I was with her, she couldn't even lift her head off of the pillow. She was so sick and was just filthy. We couldn't squeeze fluids in fast enough, and she would make a mess of things. And by this time, I was just so frustrated with Ebola and mad at how it stole the dignity of our patients.
Yeah.
And so I'd already been in the suit, the PPE, for so long, 3 hours. But I asked for a bowl of water, and I just wanted to clean her up, even if I knew for 5 minutes. So I washed her very carefully, and really up until this point, she never looked at me, she never made eye contact, she was very flat, understandably so. And on this last day, I cleaned her all up, and then I said, well, it's time for me to go now, but I'll be right outside. And I saw that she was moving her lips, and she grabbed my hand, and she looked at me in the eyes through my goggles, and she said, thank you so much for taking care of me. Thank you for being my friend. And then she said, I love you. And then that night she passed away.
It's kind of what gets you up every morning.
Every
isn't
day.
it? Yeah.
Makes you do the hard things.
Yeah. There was a lot of death amongst children.
There was a lot of children.
Now, were you also deployed, Kelly, to Congo?
Yeah, I went 2 times to the Democratic Republic of Congo. This
How-
time last year I was there.
How is that experience different, or is it similar?
It's similar, but it was vastly different because when I first went in Liberia, really the world didn't know about Ebola.
Yeah.
And because of how large of an outbreak it was in Liberia, I mean, it was very large, 28,000 cases with 3 countries worldwide, it became known to people.
Yeah.
So, but a lot had happened in the 5 years since I had been there. Now we have a vaccine,
Yeah.
and I got the vaccine when I was in the Congo.
Yeah.
So it gives a measure of safety. There's some treatment. They're not FDA approved yet, but our site was chosen as one of the sites to be administering some of the treatments, ZMAP and MAB and other treatments. When I was in Liberia, there was no hope. There was nothing
Yeah.
except supportive care. So it was a beautiful full circle for me to be able to go back and see how much has happened in the last 5 years.
Was the mortality rate the same?
It was better. It was better. A lot of education. The Congo is where Ebola started, so I think this was their 10th outbreak. So they knew about it. They weren't as much in denial.
Yeah.
But we also got to work with survivors, which we didn't do in Liberia very much. So we had survivors who had beat Ebola, got to come into the Ebola unit and help care for the children, because oftentimes the children would be in there without their parents, babies, newborns,
Wow.
and we couldn't be in the suit all day, but we could have a survivor in there who was safe and could hold them and
that's
not have them.
beautiful.
So that was really a neat change.
You don't think about that,
No.
do you? Wow, that's amazing. You know, I want to talk a little bit with the few minutes we have left. Samaritan's Purse is doing such an amazing work, and they do it in so many different areas, but tell us a little bit about just the umbrella organization that has to do with medicine.
Yeah, they offer so much medically. Of course, we have World Medical Mission, which you're familiar with. We have International Disaster Response, the DART, which is what you and I both have done, which is amazing. We also have the Children's Heart Project, which helps children in underdeveloped countries get a life-saving heart surgery. We partner with a hospital in the States or in Canada who will do the surgery, and that changes that child's life.
Yep.
And that host family gets to minister to that mom and child for that period of time. We also have the cleft palate program, which goes all over the world and helps fix cleft palates, which is such a huge thing for them. And then now we also have cataract program, and in a beautiful way they've gone back to Liberia and helped survivors of Ebola where it affects their eye, and now they can operate on their eyes for them.
Yeah. You know, I think Franklin says it well when he says medicine's a tool for evangelism, and what a great way to reach people. You know, one of the things, Kelly, people always ask me is, I'm not a doctor, how can I get involved? And my first response is, DART's a great spot for you. What kind of people with what kind of skills do you need on a DART team?
Yeah, of course, we always need all the medical sectors, but there's so much more to DART than just that. We need finance people who can help with the financing. We always have to hire and write up contracts. Human resource people, base managers who are handy and can build things and keep a generator running. Logistics people is a very big part. It's the center core of how a DART can function on the field. People who can help with shelters and distributions, putting together hygiene kits and distributing those. Water and sanitation experts. IT people. It's a huge need right now.
So really, if someone has any skills in those particular areas and they want to be involved, you know what, SP DART would be a great place for them
It's
to
a
visit.
great place to get involved, and we can teach you what you'll need to know to do it.
How would they do that? How would you go if you wanted to, if you're interested? What would you do?
Well, simply go to the website would be the first step, www.samaritan.org, and all the information's right there. If you're at the conference this weekend, we have our booths already here, and we have great people who know how to answer all those questions.
Yeah, great. Well, I'm excited for everybody to be able to tour the Ebola treatment facility.
Yeah.
Do you know where your next deployment, or are you just waiting for the next disaster?
Yeah, we never really know when it's going to hit, so usually it happens quickly, and we're out the door in 4 or 5 hours or the next morning.
That's amazing. Did you go to Bermuda?
Bahamas.
Bahamas, excuse me.
Yes, yeah, I was in the Bahamas for a month with our field hospital.
Wow, that's amazing. Well, I sure appreciate your time. Every time I've worked with Kelly, she's just like the most excellent nurse that you've ever. Plus, you're just gifted with leadership and administration. So it's just a blessing. And thanks so much for sharing your time. Thanks for sharing tomorrow at the conference at one of our breakouts too. So thanks,
you.
Kelly.
Thanks.
Appreciate it.